Elaine Torf.
Good evening. Is this loud enough?
Yes, it is.
Thank you. My name is Dr. Torf. I live in Warren. I'm a physician trained in internal medicine and infectious diseases, and I work at the Bristol Medical Center. I'm speaking on behalf of myself and my colleagues, internists, pediatricians, and specialists. I'm going to make it clear, I'm strongly in favor of a mask mandate for schools. Masks have definitively been proven to decrease transmission of COVID. They work by blocking exhalation of infectious droplets from an infected person and by filtering droplets from getting to an uninfected mask wearer. During a large outbreak on an aircraft carrier, the USS Theodore Roosevelt, people who wore masks had a 70% lower risk of testing positive. That's a fact. Several studies have shown that elementary school transmission is caused by inadequate mask use by students and less than optimal physical distancing. This was shown in an investigation of outbreak clusters in a school district in Georgia. In Florida, 1 week ago, we learned that 450 students were forced to quarantine after the first week of school. COVID infections in children have surged to the highest level since February this week. Children made up 15% of all new cases during the first week of August. Facts. While complications of COVID in children are less common, when they do occur, they're devastating. Among children and adolescents hospitalized with COVID-19, 1 out of 3 required intensive care, 5% required mechanical ventilation. They were put on a breathing machine. One sick child can infect classmates, family, elderly grandparents, and other vulnerable people around them. Studies show the vaccines decrease the likelihood of death and hospitalization, but they do not necessarily prevent infection. At the Bristol Urgent Care, we are seeing numerous vaccinated patients become sick and test positive, particularly in the last 3 weeks. They're sick enough to come in. These are not people staying home with sore throat and a runny nose. This is likely due to the profoundly more transmissible and possibly more deadly Delta variant. Our children are not vaccinated. Our jobs as adults and parents and leaders of this community is to protect our children. Their health and their lives are in your hands. A simple mask will save lives. Do not allow one of our children to become a statistic. The studies I have quoted have been published by the New England Journal of Medicine, the Journal of American Medical Association, by the CDC. I'm happy to provide details of these studies if anybody wants. Thank you.
Thank you.